Welcome to our comprehensive guide on conducting skin sensitivity and allergy tests in cosmetology. Today, we'll walk you through the essential steps and requirements to ensure safe and effective procedures for superfluous hair removal. Understanding the importance of allergy testing is crucial for both professionals and clients, as it helps prevent adverse reactions and ensures a comfortable experience. We'll begin by outlining the objectives and then move on to the necessary tools, materials, and step-by-step procedures. Let's get started by exploring why allergy tests are a must before any beauty treatment. The main objective of an allergy test in cosmetology is to ensure the client's safety by identifying any potential skin sensitivity or allergic reactions before proceeding with treatments like waxing or hair removal. By conducting this test, professionals can prevent discomfort, redness, swelling, or more serious reactions. It's also important to obtain written permission from the client, which serves as a record and protects both parties. This step is not only a professional requirement, but also builds trust and confidence between the client and the practitioner. Before starting the allergy test, it's important to gather all necessary tools and equipment. These include towels, alcohol, formalin, Lysol, boric acid, hydrogen peroxide, a trolley, plastic bowls, hand gloves, and a first aid box. Each item plays a specific role in maintaining hygiene and ensuring the procedure is carried out safely. For instance, towels are used for cleanliness, alcohol and Lysol for disinfection, and gloves for personal protection. Having a well-organized trolley with all materials ready helps streamline the process and reduces the risk of errors. In addition to tools and equipment, certain materials are essential for conducting the allergy test. Cotton and water are commonly used for cleaning and applying products during the procedure. These materials should be readily available and used in the required quantities to maintain cleanliness and comfort for the client. Proper handling of materials ensures that the test is performed efficiently and reduces the risk of contamination or discomfort. Before starting any skin sensitivity or allergy test, it is compulsory to obtain written permission from the client. This step is vital for legal and ethical reasons, ensuring that the client is fully informed about the procedure and any potential risks. Additionally, all observations and results should be recorded on a client record card. This documentation helps track the client's reactions and provides valuable information for future treatments, promoting transparency and professionalism. One of the first steps in the allergy test procedure is to check the temperature of the wax. This is done by applying a small amount of wax onto the client's forearm. Ensuring the wax is at the correct temperature prevents burns or discomfort and allows for accurate testing of skin sensitivity. This simple step is crucial for client safety and sets the stage for the rest of the procedure. After applying and removing the wax, it's important to observe the client's skin for any immediate reactions. Look for signs such as redness, swelling, or irritation. These observations help determine whether the client is sensitive to the product and if the procedure can proceed safely. Careful monitoring at this stage is essential for preventing adverse effects and ensuring the client's comfort. To further assess the client's suitability for the treatment, perform a skin sensitivity or patch test on the forearm. This test involves applying a small amount of the product and observing the skin's reaction over time. Analyzing the skin condition helps identify any underlying issues that may affect the outcome of the procedure. This step is a key part of ensuring personalized care and minimizing risks. Effective communication with the client is essential throughout the allergy test process. Ask the client to report any signs of redness, swelling, or irritation within the next 24 to 48 hours. This feedback is crucial for determining whether the treatment is suitable and for making informed decisions about proceeding. Encouraging open communication ensures that the client feels supported and involved in their own care. If the client experiences any adverse reactions such as redness, swelling, or irritation, it's important to advise them that the treatment may not be suitable. Suggest alternative procedures or products that are less likely to cause sensitivity. Handling adverse reactions with care and professionalism protects the client's health and maintains the integrity of your practice. The allergy test should be performed at least 24 hours before the actual beauty procedure. This waiting period allows enough time for any delayed reactions to appear, ensuring that the client's skin is truly compatible with the treatment. Proper timing is essential for accurate results and for planning the procedure safely. Let's review the key steps involved in conducting a skin sensitivity or allergy test. Start by gathering all tools and materials. Obtain written permission, check wax temperature, perform the patch test, observe reactions, and communicate with the client. Each step plays a vital role in ensuring safety and effectiveness. By following these guidelines, professionals can provide high-quality care and minimize risks. Maintaining hygiene throughout the allergy test procedure is essential. Use disinfectants like alcohol, Lysol, and boric acid to clean surfaces and tools. Wear gloves to protect both yourself and the client. Proper hygiene practices prevent infections and ensure a safe environment for beauty treatments. Having a first aid box on hand is a precautionary measure during allergy testing. It ensures that any unexpected reactions or minor injuries can be addressed promptly. The first aid box should be stocked with essentials like bandages, antiseptics, and other emergency items. This readiness demonstrates professionalism and care for the client's well-being. Hand gloves are a critical part of the allergy test procedure. They protect both the practitioner and the client from direct contact with products and potential allergens. Wearing gloves also maintains hygiene and reduces the risk of cross-contamination. Always use fresh gloves for each client to uphold safety standards. Organizing the trolley with all necessary tools and materials before starting the allergy test streamlines the process. Place towels, bowls, gloves, disinfectants, and first aid items within easy reach. A well-prepared trolley reduces interruptions and helps maintain focus on the client's needs. Plastic bowls are used for mixing and applying products during the allergy test. Ensure that the bowls are clean and designated for each client to avoid cross-contamination. Using separate bowls for different products helps maintain hygiene and accuracy in the procedure. Disinfectants such as alcohol, formalin, Lysol, and boric acid are used to clean tools and surfaces before and after the allergy test. Proper use of disinfectants ensures that the environment is free from harmful bacteria and allergens, providing a safe space for both the practitioner and the client. Cotton is used for applying products and cleaning the skin during the allergy test. It's gentle and effective, making it ideal for sensitive skin. Always use fresh cotton for each application to maintain hygiene and prevent irritation. Water is essential for cleaning the skin and tools during the allergy test. It helps remove residues and ensures that the skin is prepared for the procedure. Using clean water is a basic yet vital step in maintaining hygiene and comfort. Let's break down the patch test procedure step by step. First, clean the forearm area with cotton and water. Next, apply a small amount of the product to the skin. Cover the area with a towel and wait for a specified time. Remove the product and observe the skin for any reactions. Record the results and advise the client accordingly. After completing the patch test, record all observations on the client record card. Note any signs of redness, swelling, or irritation. This documentation is important for future reference and helps tailor treatments to the client's needs. Client feedback is a valuable part of the allergy test process. Encourage clients to report any delayed reactions within 24 to 48 hours. This information helps determine the suitability of the treatment and ensures ongoing safety. If the client shows sensitivity or allergic reactions, suggest alternative treatments or products. This approach demonstrates care and flexibility, ensuring that the client receives a safe and effective beauty experience. Proper timing and scheduling of the allergy test are essential. Perform the test at least 24 hours before the main procedure to allow for any delayed reactions. This practice ensures accurate results and safe planning for beauty treatments. The client record card is an important tool for documenting allergy test results and observations. It helps track the client's history and provides valuable information for future treatments. Keeping accurate records promotes professionalism and client safety. After recording observations, analyze the results to determine the client's suitability for the procedure. Look for patterns or signs of sensitivity that may indicate the need for alternative treatments. This analysis helps provide personalized care and ensures the best outcomes. The patch test is a simple yet effective way to assess skin sensitivity. By applying a small amount of product to the forearm and observing the reaction, practitioners can prevent adverse effects and ensure the client's comfort. This test is a standard practice in cosmetology and should never be skipped. Obtaining client consent is a legal and ethical requirement. Explain the procedure, risks, and benefits to the client before starting the allergy test. Written consent protects both parties and ensures transparency in the process. Prepare the client for the allergy test by explaining each step and addressing any concerns. Ensure the client is comfortable and understands the importance of the test. This preparation helps build trust and sets the tone for a positive experience. Before applying any product, clean the client's forearm with cotton and water. This step removes any dirt or oils and prepares the skin for the patch test. Clean skin ensures accurate results and reduces the risk of irritation. Apply a small amount of the product to the cleaned forearm area. Use cotton for gentle application and ensure even coverage. This step is crucial for testing skin sensitivity and observing any reactions. After applying the product, cover the area with a towel to protect it and allow the product to work. This step helps maintain hygiene and prevents accidental contact with other surfaces. Allow the product to remain on the skin for a specified period, usually 24 hours. This waiting period is essential for observing any delayed reactions and ensuring the client's skin is compatible with the treatment. After the waiting period, remove the product from the skin using cotton and water. Check the area for any signs of redness, swelling, or irritation. This step completes the patch test and provides valuable information for the next steps. Observe the skin for any final reactions after removing the product. Document any changes and discuss them with the client. This observation helps determine the next steps and ensures the client's safety. Based on the results of the patch test, advise the client on whether the treatment is suitable. If any reactions are observed, suggest alternative products or procedures. Clear advice helps the client make informed decisions and promotes trust. Document any recommendations or advice given to the client on the record card. This ensures that all information is available for future reference and helps maintain a professional approach to client care. Review the client's history and previous reactions before proceeding with any new treatments. This review helps identify patterns and ensures that the client receives the most suitable care. Throughout the allergy test procedure, ensure that the client is comfortable and informed. Address any concerns and provide reassurance. Client comfort is a priority and contributes to a positive experience. Demonstrate professionalism by following all guidelines and maintaining accurate records. Professional conduct builds trust and ensures that clients receive high-quality care during allergy testing and other beauty procedures. To summarize, conducting a skin sensitivity or allergy test is a vital step in cosmetology. It involves gathering tools and materials, obtaining client consent, performing the patch test, observing reactions, and documenting results. Following these steps ensures client safety and promotes effective beauty treatments. Allergy testing provides numerous benefits, including preventing adverse reactions, ensuring client comfort, and promoting safe beauty practices. It also helps practitioners tailor treatments to individual needs, resulting in better outcomes and satisfied clients. By conducting allergy tests and maintaining open communication, practitioners build trust with their clients. This trust is essential for long-term relationships and successful beauty treatments. Clients appreciate the care and attention given to their safety and well-being. In conclusion, allergy testing is a fundamental part of cosmetology procedures for superfluous hair removal. By following best practices, maintaining hygiene, and prioritizing client safety, professionals can deliver outstanding results and foster positive client experiences. Always remember to document every step, communicate clearly, and stay prepared for any reactions. With these guidelines, you can ensure safe and effective beauty treatments for every client.